Hello and welcome back. I'd like to introduce our next speaker, Bruce Newbold. He is professor in the School of Geography and Earth Sciences at McMaster University in Hamilton, Ontario, Canada, where he received his PhD. Trained as a demographer, his research interests include population health, immigration, and environment and health issues. Bruce is currently the director of the McMaster Institute of Environment and Health, a research institute dedicated to communicating and sharing the results of their research that unravels the complex interactions of environment and health. Bruce, I'm really excited to hear from you about your work, especially your systematic review. So I will turn it over to you.
Perfect. Thanks very much, John, and welcome to everybody. It's a pleasure to speak to you this afternoon around social media. I'm going to, as I say, or as the slide indicates, talk to you a little bit about social media and how it can be used and some of the problems with using social media. But I'm also going to say that the jury is still out in many cases around how good social media actually is and where it can be used, and we'll talk through that in a few minutes. As John mentioned, the material that I'm talking about here today is based upon a systematic review of the use of social media that we conducted a few years ago, and that was really around social media in a public health type of context, and how can public health units use social media in order to further their agendas and their outreach. But it's a lot of the findings and the discussion is applicable to very broad variety of audiences. We've updated that systematic review just this past spring, and that's about to be published shortly by Canada's National Collaborating Centre for Healthy Public Policy. And there is a web link to that resource at the end of this presentation on the additional resources that you'll be able to click on, and hopefully I've been told that it's going to be uploaded very soon or published very soon, but I don't have an exact date. And the systematic review is available in the expo room. So just getting started here. When we talk about social media, oftentimes, and in a lot of the discussions that I've had, there's three sort of what you could call big questions around what social media is. What is the effectiveness of social media for messaging? What is the impact of social media? And does the use of social media address inequalities? And I'm going to say, spoiler alert here, that the jury is really still out on a lot of these types of questions. The evidence within the literature says, well, we really don't know how effective social media is. We're starting to see some, or get some of those answers, but certainly not fully. And I think in part because we're trying to benchmark social media against sort of the traditional media outlets of print, so the newspapers and the news magazines, radio and television. And certainly radio and television are good at getting sound bites, for example, or video clips, and packaging that in a way that can be displayed very quickly and very efficiently to get a point across. Social media is different. It doesn't have yet the same sort of standard in terms of packaging, or you'll see variations, and some will be packaged very neatly and some will not be packaged well at all. So that's where a lot of these questions still sit. So where I want to take you over the length of this is trying to tackle, or at least understand and get at some of the answers for those three big questions. I'll talk about what social media is, how it's used for disseminating information, who's using it, and some of the barriers to the use of social media, because it's certainly not something that everybody is able to use. And then trying to answer the effectiveness of it, and then talking about some of the practicalities before wrapping up this afternoon. Before talking about what social media is explicitly, I think it's useful, just sort of as a starting point here, to go back to the 1960s and Marshall McLuhan, who was a philosopher or thinker of the time, that was taking a look at how media was changing how information was disseminated and used back in the 1960s. And he coined this phrase, the medium is the message. Over the intervening years, a lot of people have really sort of pulled this idea apart. But what McLuhan proposed is that the medium itself, and not necessarily the content that it carries, is the focus of study. And that's certainly what we're doing here today, that the medium, so social media, is what we're interested in understanding. McLuhan went on to talk or argue that the medium affects, so social media affects the society in which it plays a role, not just by the content that's delivered over the medium, so over social media, but also by the characteristics of the medium itself. And we'll certainly see that social media has some specific characteristics in terms of how it's portrayed, how it's used, and who's using it, or sort of the finesse of using social media for delivering messages. So social media can drive change. It can shape or control how people act and behave. But if we want that message to succeed, then we also have to see what that medium is actually saying. So the medium, social media, needs the conditions for growth. You might have heard, for example, about how messages or videos go viral on YouTube, for example, or on other websites. What is it that allows those pieces to go viral? What's significant about them? Why do a handful of pieces go viral and most of the other material on social media just sort of sit there? I'm not here to answer that. I could certainly give some hints as to what's happening here. But we won't be getting into that. But we do need to make sure, and it gets into the practicalities that we'll be talking about later, that social media is successful here. Okay, so what is social media? And I'm sure that most of you are familiar with the basic sort of forms of social media. So things like Twitter and Facebook, YouTube, various blogging sites that we often see or hear run into every day, or maybe even use every day. Sort of more broadly, we can think of these social media pieces as what's been colloquially defined or termed as Web 2.0. And that Web 2.0 is defined by a very interactive user environment that enables users to contribute content. And when I say users, that is really anybody that has access to social media can contribute to that sort of evolving piece of work. It continues to evolve over a period of time as different actors contribute into that piece of work. I think here, just sort of as to point out the contrast, Web 1.0 would be the traditional websites, emails, list servers, where content is sent out from a particular agency or group or individual, and others don't have the opportunity to comment on it, to add to it. So it's really sort of a passive versus active distinction. The traditional website and email list, very passive because you just receive the information. Web 2.0 and social media is active, that everybody is able to engage in social media and the discussions within social media. So how do we use social media for, or what do we use it for? Well, probably most of us on a day-to-day basis in our personal lives are really just using social media in order to keep in touch with family and friends, to, maybe you're posting about what you did on the weekend or where you are, the family trip, or things like that. It allows us to engage in conversations, maybe about what we did on the weekend or what's coming up. We can also use social media to disseminate information, to help or facilitate other groups or other individuals, and we can use it to learn. So it becomes a resource to learn from. Social media can be a news source, so that social media and particularly Twitter becomes a source of information. Maybe before even the news outlets break that information. And social media also allows users to link or share information. So again, just going back to Facebook, you might see people importing or sharing pieces and news stories off of other news sites or from other social media outlets or from other friends or users of social media. So it's really, social media allows that information to really sort of be expanded and to reach a much broader audience. A lot of the benefits of social media revolve around the idea that it's real time. Last week, during the terrorist attacks in Ottawa, Twitter lit up, so everybody was on Twitter, and in that case, oftentimes news or updates and details about what was happening occurred through Twitter and social media outlets before the news outlets, the traditional news, TV, radio outlets were able to take that information and verify that information. So it was already being disseminated to the public. Another benefit of social media is that information can be conveyed in different ways. So text and video or combination of both of those, and that enables then people with different needs or special needs to be able to retrieve that information, to share the information, and to pass it along. Social media also benefits or increases the number of interactions between individuals because it is this ongoing conversation, because people can contribute or add to that, to the social media piece. The conversation continues to evolve with social media, bringing more people in. And also that you can share or tailor the information, who you're directing it to, who is the audience, and we'll pick that up towards the end of the discussion around who that audience is and the importance of identifying who that audience is. Social media certainly allows an increased number of sources of information because every individual user can, in theory, become a source of information. They can contribute to that conversation as well as bringing in those other news pieces or pieces from elsewhere on the web. Social media can create spaces where information can be shared and amongst different audiences. So one of the uses of Facebook that you might often see is the creation of group pages, so that a group with a particular interest or issue will be able to meet there and discuss and share information related to that. But it's really geared towards that particular group, however you want to define it. Social media also provides a lot of peer support, which is particularly important for people that may have more limited abilities for social inclusion within the broader society. So they can turn to social media, turn to their electronic sources to gain that support, maybe without leaving home, without leaving their room, for example. So in that respect, social media really offers the opportunity to increase the accessibility to information available to different groups, regardless of their socioeconomic status, their race, their ethnicity, or their location in space. So who uses social media? And get into some of the sort of details of this here. Not everybody uses social media in the same way or to the same degree. So there's a variety of different social media platforms, the YouTubes, the Twitters, the Facebook, and so on. But somebody or an organization, a group might be on one social media platform but not another, or they might be on a variety of them. We certainly see that from a very broad perspective, the youth, and probably not a surprising assumption here that the youth are more likely to use social media. They've grown up with computers and computing and working online. There's nothing different there. But the elderly, the old, are less likely to use social media, and they tend to be more reliant on the more traditional sources of communication, the radio and the television and the TV. Social media is used by a broad variety of groups, so government, service providers, community groups, or individuals. In there, I've just put two different Twitter feeds, one from Disability, U.S. Government, and one from the World Health Organization, both providing, Twitter accounts, updated information that you're able to then sort of tap into and share and be part of that discussion associated with that. I just saw coming up there from Bonnie that the use of mobile devices, and yes, it certainly does account for that, and I'll be speaking more to that in just a moment here around the use of mobile devices. Now, as I said, not everybody uses social media, and there are some significant barriers to use, and just to quote a few statistics, if looking at the American population, males and females are approximately equally likely to have access to the internet through broadband at home or through their mobile phones, their smartphone phones, for example, and they're equally likely to use, males and females equally likely to use those platforms. But we do see differences in terms of American society, in terms of who's using it. So about 80% of white non-Hispanics are connected, 75% of Hispanics are connected, so a lower proportion of Hispanics. 46% of Americans aged 65 and older are connected, and 95% of Americans aged 18 to 29 are connected. So there you see that differences in terms of cohort type of effects and who's using it. If you're poorly educated, so Americans with a high school degree or less, about 52% use social media or are connected to internet and broadband. 92% of those who have a college education are connected. So a huge disparity there in that. And also differences between urban and rural, about 70% in rural, 80% in urban. So location and access is certainly important to the ability to connect, and then if you're connected, then you're able to, or more likely to be engaged in using social media. Rural and remote areas, more important. The smartphone or mobile phones give the opportunity for greater connectivity, but there's still going to be holes in the network or places in those remote locations where access is extremely limited. Perhaps less so in the U.S. than what I would observe here in Canada, for example, but even in the U.S., there are holes in the network where you wouldn't have that broadband access. Knowledge of computing is important. So once you gain access to the internet, or once you have access to the internet, you need to know how to use it and how to move through health information, which is this idea of e-health literacy. So that's the ability to seek, to find, understand, and appraise health information from online resources, and then be able to apply that knowledge to address a health problem, for example. So it's really knowing, once you're online, knowing how to use the information. We certainly see barriers in terms of socio-demographic or socioeconomic effects. So if you're poor, low educated, low income, I'll talk a little bit more about the digital divide in a moment. Language and ability or literacy affects the ability to be online and using social media, so back to that e-health piece, and also physical ability. And so for Americans living with disability, there may be sort of a triple jeopardy here, that we know that for, on average, Americans living with a disability are more likely than other adults to live in low-income households, to have lower levels of education, more likely to be older, so they may be more excluded or are more excluded in terms of their use of social media and web-type resources. And just in terms of that, to expand on that idea of the digital divide, we certainly see that. So this is use of internet and broadband, and this is broadband at home as opposed to the idea of a mobile phone. But it does distinguish between those who are living with a disability and then all adults, and we certainly see both in terms of the use of internet and access to broadband at home that those living with a disability have much lower levels of use. Certainly, This is from 2013 study that was published by the Pew Research Center. Use of mobile phones changes that landscape a little bit, but it still goes back to that ability for e-health literacy and knowing what to do with that information, as opposed to just using social media as a platform to engage with friends. And I think when we talk about certainly younger cohorts, the youth in society, they're more likely to be using social media as a platform to stay in touch with individuals. This slide in part speaks to the previous one. So it's 54% of adults living with a disability use the internet versus 81% of adults with no disability. They share the same barriers, so individuals living with a disability share the same barriers that we see within the broader population, so education status, income status, their location. All of those create barriers, so having a disability, living with a disability, as I said, may create additional disadvantages in that individuals with disability may be further isolated from society. What are the implications of that? Well, no broadband, and this specifically says no broadband at home, but, no connection, again, say through a mobile home, you're disadvantaged in terms of finding job opportunities or learning career skills. You're at a disadvantage for gaining health information. And what I don't have on that slide there is that you're also disadvantaged in terms of social connections. So the ability to be online and talk with other people, sharing similar situations, similar stories. So a group of people where social support, social connections can be made, that if you're not able to connect in those ways, you're less likely or you're at a disadvantage in that respect. Having broadband at home, and again, it's specific to broadband at home, but it's any sort of connection through a smartphone that you're more likely to be accessing health information through online forums and those shared groups or discussion types of groups, and you're more likely to post your own experiences. So some people have argued that you have a deeper connection to the online world, and then for Americans that are living with a disability, I think it's really that it could be argued that there's a deeper connection to society more generally, that social media provides that opportunity for engagement within the broader society, and by being connected, you're better engaged in society, or having that feeling of greater inclusion within society more so. So having access to social media then may improve the connections with peers, with healthcare providers, or with other organizations. And there is a caveat there. There is that may, because of some of the barriers that we know still exist. So that digital divide is still very real. We've been talking about the digital divide for some years, and it is decreasing, but it is still there. It is still very real, that it's not, it's access to the internet, access to smartphones, access to broadband is not universal by any means. From the perspective of individuals living with a disability, there's the physical challenges of accessing content, the use of the keyboard, or visual issues, for example, and so adaptive devices, adaptive technology will certainly help to facilitate that access to the internet along the way. What's the effectiveness of social media? And this is where the discussion gets a little bit blurry, that the use of social media as a platform to disseminate information, so to talk, to relay information to the broader public. it continues to evolve because it is so new. We've really only been talking about social media and seeing social media as a platform to get information out for the past few years. So it's very difficult to define and evaluate the success of social media as, say, a intervention or as a tool for communicating information. Likewise, there's very little information on what the most effective type of social media communication is, how the effectiveness of social media compares to the use of more traditional types of media sources, so that newspaper or radio and television. We still don't have a good understanding of that. The best that we can say is, well, if you're older, you're still more likely to rely on more traditional types of sources, media sources, and if you're younger, you're more likely to turn to social media. That you don't open up a newspaper. Maybe you don't even know what a newspaper is or know what a news magazine is. Social media certainly complements the existing media, but like print or broadcast, but that's where we see these differences in terms of age in society, in terms of who's using it more or less. Problem, or one of the issues around the effectiveness is that social media is less objective. Because you have so many people that are able to contribute to the conversation here, it can change the flavor of the conversation, or conversations can be directed in particular ways, if somebody has a particular agenda. And social media really lacks the controls or oversight of more traditional type of media. So you can put a message out, but other people, because they can contribute, they can participate in a social media message, they can really work to undermine it. An example might be the use of vaccinations. So a public health unit, and I'm drawing upon some of the experiences that we saw in our review. Public health unit might say, it's time to get your seasonal flu shot. And sending that out as an information source and saying, here's where you can get it, but then other people are saying, oh no, you don't want your flu shot because of this, and then starting to derail or change the topic of conversation, really, and so undermining those public health recommendations. So it's the volume of the content, it's the reliability. You have no way to check on, or it's more difficult to check the reliability of the content and its accuracy and or inaccuracy.
Bruce, I noticed that Bonnie has raised a question about effectiveness and if social and traditional media combinations may be more effective.
Yeah, and that's a good question. Using them in tandem, it might be that's the case. And I see one comment there that from Robin saying, the most effective type of social media is very context specific, and that's certainly what we see in the systematic review, that it needs to be a very sort of targeted type of piece. Bonnie's question there, did we ever really control the message? Yeah, exactly. It's a good question, and we certainly know that different media outlets will certainly have different agendas. But there you could at least say, okay, it's this media outlet, and I know their views. I know which way they say lean politically or where they stand on these issues. From a social media perspective, you've got dozens, tens of hundreds, or whatever, potentially different directions where that message can be drawn from or taken, different countervailing viewpoints, and that's where it becomes extremely difficult. You don't know where the individual or the group or the agency stands, or it's much more difficult to understand that. And just going back to Bonnie's question there about combining social media with traditional media, it may work, but it may not, and I say that because it's who's using those different pieces, going back to the sort of cohort type of effect, that older cohorts more likely to use their traditional media, younger cohorts more likely to use social media, and the two may not meet. They're not necessarily equal. If anything, it's the two different, or the different types, the traditional media and the social media, becomes a way of getting the the message out to a broader group or to the entire population, recognizing that some groups will see it and some won't, but they will get that message elsewhere. So effectiveness of social media remains questionable. We certainly see that how people react to social media resources or comments, discussions, depends upon their own individual values, what their peers say, what their social or their demographic, cultural situation is. There are very few studies that report any sort of behavioral change. So some of the studies that are out in the literature, for example, are talking about the use of social media around smoking cessation, or the use of social media for improving exercise uptake. So those are fairly targeted type of outcomes, but the actual change in behavior, so did people actually quit smoking? Did people actually take up greater exercise? That's where it becomes much more mixed. We don't have a lot of information there. And in part, it goes back to how it may go back to how part of the initial message was actually sort of framed or formed, and who it was being targeted to. The other problem is that because social media it creates this opportunity for discussion and dialogue, it may actually short-circuit some of our best intentions of trying to encourage people to, say, use their doctor or to seek more professional care, to knock on the door of an agency or whatever, that they think they found, the individual user thinks that they found the information, and it stops there. Their sort of search or their quest stops. I know my answer. I'm good. I don't need to seek any further support here. Just in terms of some of the practicalities, so if you were to use social media around it, and I think the CDC has really sort of led the way here, or provided an excellent set of benchmarks or suggestions in terms of how social media can best be used. Personalization, so it's a personalized type of message. How is that message presented, and who is meant to be participating? And so there's a set of best practice documents and toolkits available through the CDC. The link is on the slide here, and also, I believe, in the resources at the end of this presentation. This goes back to one of the comments that was raised a moment ago, but around, who is the message? So if you're using social media, how do you target the message, and who is it being targeted toward? So you need very clear objectives associated with the social media platform to identify the target audience. That sort of a scattergun type of approach won't work, that if you want to reach somebody, you need to be targeting that group very specifically. Who you're talking to is important, and who you're sending that message to is important, but so is identifying the resources. So social media isn't sort of a costless type of piece. That if you're thinking of using social media within an organization to relay information, you need to think about the staffing type of piece. You need to think about the policy type of piece. So staffing, who posts, who's actually posting to social media, who's checking the content of it, how frequently do you post to social media, and is it across a variety of different platforms or just one? Who checks the ongoing discussion, if there is a discussion around that social media post? And then having some sort of policy on use. What is the information that you actually want to put out there? Who's creating the message? There's one person that posts it. Who's creating the message? Who's checking the message before it gets posted? Because once it's out there, it's out there. You can't retract that. And we see that sort of example on a day-to-day basis in terms of web use. Use of the web. Once it's out there, it's gone. You can't pull that back at all. So just a few quick concluding thoughts here. Keep in mind that social media is rapidly changing. It's changing how we communicate with each other, how we communicate and disseminate ideas, and who we're reaching. But it's not a one-size-fits-all because of those differences in terms of who's more likely to use it or who's less likely to use it, because of those socio-demographic and socioeconomic type of barriers in terms of the use. So we know that some parts of America, some groups in America are less likely to use social media than other groups. What about the actual message? As I said, it has to be, or what we see within the literature right now is that the best use of it is when it's a very targeted, informational type of piece that is being broadcast out to those people that are on or using social media. And then the final comment there is, go into it with a game plan. And that's where using some of those CDC resources, for example, will be critical in terms of setting this sort of information up, that, that if you help to minimize problems associated with the use of social media. As I said, it's a fluid field. People are still experimenting with it and trying to understand how it's used and when and where and so on. So you want to go into it carefully, but with that game plan. So with that, I believe that's my last slide. The resources that I mentioned in terms of some of the sort of key readings, links are available in the following slides, but I'll open it up there for questions. Thank you.
Okay, thanks very much, Bruce. That's very, very informative. I do have a few questions here that have come in, so I'll just, since we've got some time, let's just work our way through these. First one, how do you best reach across generations with a social media strategy or across cultures? On the other side of the coin, what are ways to reach a specific audience?
So I guess it might be easier to answer the second part of that question first, in terms of reaching a specific audience. That's where you need the targeted type of communication piece, so it's of relevance to a particular group. One thing that I didn't mention is that one of the, another benefit of social media is that you can connect, you can forward, relay types of information. So you hear about people retweeting. So they've received a tweet through Twitter, and they say, oh, well, this would be of interest to the group that I'm participate in, and they'll forward it on, or you share it on Facebook. So you're sort of expanding that reach of the message. I know that doesn't really answer the question, but it goes back to being targeted. And understanding who it is that you're trying to reach. That there's no sense in talking about reproductive health issues to a very old population, or there's very limited need for that. Sorry, John, what was the first part of the question?
First part of the question was, how do you best reach across generations?
Oh, right, yeah.
Strategy. Or across cultures.
Yeah, across cultures, across generations. Again, that's sort of a place where there's no hard and fast best case or, evidential type of answers. A lot of what we've seen so far is a little bit of trial and error. For reaching particular groups, there would be, typically discussion groups or forums that may be for, geared towards a particular demographic within the population. So if you had access or were able to gain access into those forums, then you would be able to reach that group. Otherwise, it's sort of sharing that information, that if you're a group or an agency, part of the agenda is really just sort of setting yourself up, that you create the capability to produce information or get information out through social media. And then as you start relaying that information, people will also identify with it to share it and so on. And your audience will be able to grow through that sharing. Not a perfect answer, I know, but it reflects that there isn't this sort of hard and fast way or rules associated with here's where how to reach this particular audience. Because in part, social media is very sort of, despite it being accessible and widely available, there are different sort of components or pieces where some people will plug in but not elsewhere. So it can be difficult to just immediately say, oh, I'm going to go after this group and I'm going to be able to connect with them.
Sure. Bruce, last year our KT conference topic was focused on KT measurement. So we have a question coming in, really I think about measurement issues. But the question is, in your presentation you spoke about the effectiveness of social media and that it remains questionable. How should we measure our own strategies to see if our social media is making a difference?
Well, I guess there's different ways there. So one is how many people are you reaching? And as with my demographer hat on, I would be saying that's a stock. So it's just the number of people that you're reaching right away. Another piece would be the flow. So as you conduct social media and as you change your social media perspectives, how do you see an increased uptake? So more followers, more people sharing, more people joining a group. And you'd be able to chart that or count that over a period of time to say, okay, well, between January 1 and July 1 or whatever window you want to use, here's the change in terms of the number of people, the uptake of our social media. You could also take a look at it from the perspective of who else is sharing your information. So, one way to say, yeah, this piece of information was particularly relevant is when it gets shared by other services, by other social media outlets. And if you're seeing that, it's growing your connections, but you're also seeing other people utilize that information, so it's certainly an indicator there. I think the final piece of measurement would be to say, or to have some way of measuring that change in attitude, the change in behavior. So if you're putting a message out and saying, and looking for a change in terms of how people do things or how people behave, can you get an understanding or a number of the who actually did change their behavior, who actually changed their actions? And I could provide some additional links associated with that. What we've seen so far is that a lot of people get the message, but it doesn't necessarily lead to that change in terms of behavior or attitudes at the end of the day. But maybe that's how the information was relayed in the first place. There's those sort of other variables along the way.
Very good. Imagine this is going to be our last question. It's been raised by Hannah, and her question is, since the population of persons with disabilities has a greater number of barriers, do you think that social media can still be an effective tool to reach this population?
I do, and I say that in part because of some of the dramatic changes that we're seeing or will see in terms of how people can access, a computing type of environment. So, what new technologies and tools will facilitate their engagement in social media? And I think we're really on the cusp of some very dramatic changes in terms of how people can communicate and engage there. So that's why, the primary reason that I think that social media will be an important platform. Just something as simple as voice recognition. There we've seen tremendous strides. So, using, rather than the physical needs of keyboarding, we can turn to voice and use that, and then you're connected.
Very, very good. Well, we've reached that time, Bruce. So I thank you very much.